COVID numbers have been pretty good so far this spring, but like an alligator just lurking underneath the surface of the water, it's still there. I'm Rob Freelove, Chief Medical Officer and Senior Vice President at Salina Regional Health Center.
Dr. Freelove, thank you so much for being on the show. It's been kind of nice to catch our breath a little bit from COVID, but I know it's not gone. Where are we at with the numbers?
Numbers are still looking really pretty good. You know, here we've been very fortunate this spring. We've had low case numbers. We've had low hospitalizations, very few deaths, if any. It's been nice to see 0 COVID inpatients on the report I get daily for several days in a row. You know, we'll maybe have 1 or 2 here and there, but numbers have been pretty good. I will say here in the last few days, we started to see just a little bit of an uptick in the number of cases that we're getting back that are positive. Haven't seen an increase in hospitalizations yet, but unfortunately across the country we're seeing increases in cases. The new variant seems to be kind of taking hold in some areas across the country, so we are seeing an increase in cases and unfortunately an increase in hospitalizations.
And because of the numbers being lower, the hospital is, you know, at least for services, wide open, right?
Yeah, right now we are. We've lifted the restrictions we've had on surgeries and a few of our other services, so we're wide open as far as those services go. Still struggling a little bit with staffing issues in some of our departments, and that's going to be probably a long-term thing that not just us, but everybody has to deal with. But yeah, we're wide open as far as services go. And we've released or backed off on some of our restrictions, some of our visitor restrictions in the past few weeks as well.
What do you say to somebody who says, well, now that the numbers are low, I'm not going to worry about getting vaccinated, not going to worry about getting my booster shots? What do you say to them?
They're wrong. Yeah. Now, again, especially with what we're seeing across the country, and you know, COVID's not gone. It's not over. Maybe we moved from pandemic to endemic, but it's still out there. And like the flu, it's going to be out there, and vaccination is going to be an incredibly important tool in keeping it in check. So yeah, especially with what we're seeing now nationwide with the numbers, the vaccines are still very effective in helping to prevent severe illness, helping to prevent hospitalizations, helping to prevent death. Might still get ill, but shouldn't get, much lower chance of hospitalization and death. So somebody who's not vaccinated, they should get vaccinated. If somebody's vaccinated but hasn't gotten their first booster, they should go get their booster. And probably now, with what we're seeing across the country, it's probably the right time for those people who are 50 and over or who have risk factors that would put them at higher risk for severe disease if they were to get COVID. It's probably time for them to go get that second booster.
Thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.